Role of government in health. Health for all. The practice of public health has been dynamic in India and has witnessed many hurdles in its attempt to affect the lives of the country. Since independence, major public health problems like malaria, tuberculosis, leprosy, high maternal and lately human immunodeficiency virus (HIV) have been addressed through a concerted action of the government. Challenges before public health. The new agenda for public health in India includes 1. The epidemiological transition, rising burden of chronic non-communicable diseases. 2. Demographic transition, increasing elderly population. And 3. Environmental changes. In India, the tobacco attributable deaths range from 8 lakh to 9 lakh per year, leading to huge social and economic losses. Mental, neurological, and substance use disorders also cause a large burden of disease and disability. The causes of health inequalities lie in the social, economic, and political mechanism that led to social stratification according to income, education, occupation, and gender and race or ethnicity. Lack of adequate progress on these underlying social determinants of health has been acknowledged as glaring failure of public health. Alma Ata, Health for All. To meet the formidable challenges, there is an urgent call for revitalizing primary health care based on the principles outlined in Alma Ata in 1974. These principles include universal access and coverage, ground of equity, community participation in defining and implementing health agendas, and intersectoral approaches to health. Attempts to achieve health for all have been carried forward in the form of Millennium Development Goals. Public health is concerned with disease prevention and control at the population level through organized efforts and informed choices of society, organizations, public and private communities, and individuals. However, the role of government is crucial for addressing these challenges and achieving health equity. The Ministry of Health and Family Welfare (MOHFW) plays a vital role in guiding India's public health system. Role of government within the health sector. Health system at a glance. Important issues that the health systems must confront are lack of financial and material resources, health workforce issues, and the stewardship challenge of implementing pro-equity health policies in a pluralistic environment. The National Rural Health Mission (NRHM) launched by the Government of India is a leap forward in establishing effective integration and convergence of health services and affecting architectural correction in the healthcare delivery system in India. Health Information System. The Integrated Disease Surveillance Project was set up to establish a dedicated highway of information relating to disease occurrence required for prevention and containment at the community level. But the slow pace of implementation is due to poor efforts in involving critical actors outside the public sector. Health profiles published by the government should be used to help communities prioritize their health problems and to inform local decision making. Public health laboratories have a good capacity to support the government's diagnostic and research activities on health risks and threats, but are not being utilized efficiently. Mechanisms to monitor epidemiological challenges like mental health, occupational health, and other environment risks are yet to be put in place. Health research system. There is a need for strengthening research infrastructure in the departments of community medicine in various institutes and to foster their partnerships with state health services. Rules and regulations. Their implementation. A good system of regulation is fundamental to successful public health outcomes. It reduces exposure to disease through enforcement of sanitary codes. Example, water quality monitoring monitoring, slaughterhouse hygiene, and food safety. Wide gaps exist in the enforcement, monitoring, and evaluation, resulting in a weak public health system. This is partly due to poor financing for public health, lack of leadership and commitment of public health functionaries, and lack of community involvement. Revival of public health regulation through concerted efforts by the government is possible through updation and implementation of public health laws, consulting stakeholders, and increasing public awareness of existing laws and their enforcement procedures. Health promotional activities and program. Development of community-wide education programs and other health promotional activities need to be strengthened. Much can be done to improve the effectiveness of health promotion by extending it to rural areas as well. Observing days like Diabetes Day and Heart Day, even in villages, will help create awareness at the grassroots level. Human resource development and capacity building. There are several shortfalls that need to be addressed in the development of human resources for public health services. There is a dire need to establish training facilities for public health specialists, along with identifying the scope for their contribution in the field. The Public Health Foundation of India is a positive step to redress the limited institutional capacity in India by strengthening training, research, and policy development in public health. Pre-service training is essential to train the medical workforce in public health leadership and to impart skills required for the practice of public health. Changes in the undergraduate curriculum are vital for capacity building in emerging issues like geriatric care, adolescent health, and mental health. In-service training for medical officers is essential for imparting management skills and leadership qualities. Equally important is the need to increase the number of paramedical workers and training institutes in India. Scope for further action in the health sector. School health, mental health, referral system, and urban health remain as weak links in India's health system. Despite featuring in the National Health Policy, school health programs have become almost defunct because of administrative, managerial, and logistic problems. Mental health has remained elusive even after implementing the National Mental Health Program. On a positive note, innovative schemes through public-private partnerships are being tried in various parts of the country in promoting referrals. Similarly, the much-awaited National Urban Health Mission might offer solutions with regards to urban social determinants of health, living conditions. Safe drinking water and sanitation are critical determinants of health which would directly contribute to 70 to 80% reduction in the burden of communicable diseases. Urban planning. Provision of urban basic services like water supply, sewerage, and solid waste management needs special attention. The Jawaharlal Nehru National Urban Renewal Mission in 35 cities works to develop financially sustainable cities in line with the Millennium Development Goals, which needs to be expanded to cover the entire country. Nutrition and early child development. Recent innovations like universalization of integrated child development services (ICDS) and setting up of mini Anganwadi centers in deprived areas are examples of inclusive growth under the 11th five-year plan. The government needs to strengthen ICDS in poor performing states based on experiences from other successful models. Example, Tamil Nadu, upgrading kitchens with LPG connection, stove and pressure cooker, and electrification. Use of iron fortified salt to address the burden of anemia. Micronutrient deficiency control measures like dietary diversification, horticultural intervention, food fortification, nutritional supplementation, and other public health measures need intersectoral coordination with various departments. Example, women in child development, health, agriculture, rural and urban development. Food security measures. Innovations are required to strengthen the public distribution system to curb the inclusion and exclusion errors and increase the range of commodities for people living in very poor conditions. It is essential that the government puts forth action plans to increase domestic food grain production, raise consumer incomes to buy food, and make agriculture remunerative. Population stabilization. There is all-round realization that population stabilization is a must for ensuring quality of life for all citizens. Formulation of a national policy and setting up of a National Commission on Population and Jansankhya Sthirat Kosh reflect the deep commitment of the government. development. However, parallel developments in women empowerment, increasing institutional deliveries, and strengthening health services and infrastructure hold the key to population control in the future. Community participation. Community participation builds support for policies and programs, generates compliance with regulations, and helps alter personal health behaviors. One of the major strategic interventions under NRHM is the system of ensuring accountability and transparency through people's participation, the Rogi Kalyan Samitis. The Ministry of Health needs to define a clear policy on social participation and operational methods in facilitating community health projects. Potential areas of community participation could be in lifestyle modification in chronic diseases through physical activity and diet modification, and primary prevention of alcohol dependence through active community-based methods like awareness creation and behavioral interventions. Private sector, civil societies, and global partnerships. Effective addressing of public health challenges necessitates new forms of cooperation with private sectors, public-private partnerships, civil societies, national health leaders, health workers, communities, other relevant sectors, and international health agencies, WHO, UNICEF, Bill and Melinda Gates Foundation, World Bank. It is true that a lot has been achieved in the past. The milestones in the history of public health that have had a telling effect on millions of lives: launch of expanded program of immunization in 1974, primary healthcare enunciated at Alma Ata in 1978, eradication of smallpox in 1979, launch of polio eradication in 1988, FCTC ratification in 2004, and COTPA Act of 2005, to name a few. It was a glorious past, but the future of a healthy India lies in mainstreaming the public health agenda in the framework of sustainable development. The ultimate goal of great nation would be one where the rural and urban divide has reduced to a thin line, with adequate access to clean energy and safe water, where the best of healthcare is available to all, where the governance is responsive, transparent, and corruption-free, where poverty and illiteracy have been eradicated and crimes against women and children are removed. A healthy nation that is one of the best places to live in. Unpacking gender and empowering women. Right across the world and throughout history, women have been given inferior status compared to men. But we tend to forget that women bear children and nurse infants. They automatically assume more responsibilities for child care. Consequently, women often work in the house, while men work outside. Women have always contributed to the economic and social life of a country. As homemakers and mothers, they do invaluable work. It is very difficult to measure the true value of their effort. Their contribution goes unnoticed. Gender inequality is one of the prominent social evils that our society faces. It implies unequal treatment meted out to boys and girls. It may also be defined as discrimination made between males and females. Not only in India, but in almost all the countries of the world, this evil exists. In fact, gender is a social aspect and not a biological phenomenon.